Hey everybody, it's Dr. Tiffany at Sioux Center Chiropractic, and we're located in Sioux Center, Iowa, and I'm with Dominique. This is actually my sister. She flew in from San Francisco, and she's staying with us for a few weeks, and she's been having some pain, so we're going to get her adjusted. Dominique, tell me a little bit about your pain.
Yeah, so I'm a yoga instructor, and I just traveled here. I'm a side sleeper, so I have a little bit of pain in my neck, a little bit of tightness, and then my lower back as well.
Tell me about your low back. Where do you feel it? Mostly sitting, when you're sleeping?
A little bit of both. I'd say a little bit in my lower back when I get up, so I can tell I've kind of been on my side. But I would just say just a little bit of tightness. Yeah, maybe my legs, maybe a little bit uneven.
All right, let's see if we can move you in. Let's try and find her pain. So we're going to put her through a functional assessment. So I'm going to move her cervical spine and her thoracic and lumbar spine, and we're going to see what's not moving like it should when you move. And feel free to tell me like where you're feeling it, like if you can't get through emotion, where you're feeling the restrictions at. Okay, so stand right here, and I'm going to have you mirror me, Dominique. Okay. All right, come up from the wall just a little bit, and I'm going to have you look as far over one shoulder as you can. Got any pain with that? Nope, other side. Little tightness? Okay, when you went the other way, was the tightness in the same spot or opposite?
Opposite.
Okay. Go ahead and put your chin all the way on your chest.
Where is it going?
Yeah, tell me where the pain's at.
Just back here on the left side.
On the left side, kind of going from your shoulders up, or
from my shoulders up to
the base of your.
Yeah.
Okay, let's take your chin and go all the way on the roof. All the way on the roof. Point that all the way to the ceiling. Where do you feel that?
Kind of my right back.
Yeah.
Back of my neck.
Okay, come on back down. And now you're going to try and, with your feet together, touch your toes for me. Good. Any pain with that?
No, just a little popping. I would say just a little bit of tightness back here.
A little bit of tightness. Okay, come on up. Both sides pulling.
Both sides.
Okay.
Yeah.
Try and, just like we did with your neck, you're going to rotate your upper body and your neck all the way to one side. As far as you can go. Good. Any pain?
No, just tightness.
Tightness on that left side?
Left side, yeah.
Okay. Other way?
A little bit better.
A little better?
Not as much tightness, but
okay.
some tightness.
Okay, you're going to bring your hands up and you're going to follow them as far as you're comfortable going back, okay? Got any pain with that?
Not as much pain, no.
Good.
Just a little bit of tightness.
Is it in the front or the back, your tightness?
The back.
The back.
Yeah.
Okay, go ahead and have a seat right here.
Okay.
We're going to put you through a motion palpation. So what I'm going to do is I'm just going to feel each of her joints. I'm going to start in her SI joints, palpate her sacrum, her coccyx, and I'm going to palpate all the way up in her lumbar spine, thoracic spine, and cervical spine. And your job is just to tell me like what you're feeling. If you're like, ooh, right there, ooh, that's tender, just any communication that you're feeling. And that'll help me kind of build the case as to what needs to be adjusted.
A bit of tenderness, tightness right there.
Right there. Yeah. Is it worse when I go down here?
No.
No, worse up here.
Worse up, yeah. Yeah, a little bit of tenderness, tightness right there.
Good. I want you to rotate with me. What about when I go that way?
I can feel it.
Yeah? Okay, let's go the other way. Any pain there?
Just a little bit of tightness.
Okay, is it worse on the right or the left?
The left.
Yeah,
right
for sure.
Yeah.
There. All right, we're going to keep moving this lumbar spine up into the thoracic in this extension motion. All right there.
Yeah.
So what I feel is just almost like a brick. Like whenever I push into a joint that's moving good, it should feel kind of like the resistance of pushing into a brick of cheese. And up here, I definitely feel like I just hit a brick wall right there.
Yeah, I can feel it all the way, right where you touched, all the way down.
Yeah?
Yes.
Good. All right, interlace your fingers here, and you're going to go around your neck for me. Good, and bring those elbows in. And I want you to just put some weight on me. Madison, you can come right up here. So I'm just going to do the same thing, and I'm just going to add extension into this thoracic spine. Ugh. Right there, yeah? That whole left side on you. Bring these arms down for me. Good. And I'm just going to palpate this cervical spine. So same thing. I just have my hands, and I'm putting it right on each cervical, on the posterior aspect of each cervical, and I'm just adding normal, what should be a normal amount of extension into each vertebra. And then I'm getting feedback as to what's not moving right there. Now I can add a little rotation. Yeah, I'm sorry. I always say the worst part about being a chiropractor is I've got to find your pain first. So I know you've been having a little bit of headaches. You got adjusted since you've flown, and we got you a little bit of a smaller pillow since you are a side sleeper. Have you had headaches the last 2 days?
Not like when I landed, no.
Okay, good. Good. All right, so we're going to start by adjusting your low back.
Okay.
So I want you to lay on your side facing me.
Okay.
And bend this top knee. And just relax that ear down. Perfect. You've done this before.
Maybe.
Good. So what I'm doing is I'm just moving this pelvis through this flexion extension pattern with her knee. And right there still. Good. So we're going to add, so I put her body into this flexion pattern, and I'm going to bring her to me. And I'm going to keep that pelvis flexed up. And then I drop down, adding force through the joint. Oh, so much better. Correcting that lack of flexion she had there. Good. Let's go to the other side, Dominique. So we're going to get her in position. Same thing. I'm just going to move her. Any pain with any of that?
No, just tightness on the left side.
Tightness on your left still.
Yep.
I'm going to bring you to me. Good. All right, go ahead and sit up for me. We're going to put this board. All this board does is this is just a little bit harder than my nice soft table. So it gives me a little bit more extension as I'm trying to put extension into the joints. Go ahead and lay on your back for me. Good. Go ahead and give yourself a hug. There we go. Perfect. I'm going to bring you to me. We're going to palpate a little bit more. Here. So whenever I roll her over my hand, that naturally puts her into some extension. And then when I do what's called a body drop, I'm going to put my weight over her with a little bit of force and gravity into this extension, and we're going to see her regain that motion that she's not doing. Relax, relax. Perfect. Come on up. Yeah. All righty, and now we're going to come, and she likes to be adjusted in her cervical spine in the chair. So Dominique, come on over here. So she has a chiropractor in San Francisco, but she obviously is traveling, so we're taking care of her. And this is like payback from all the time she let me adjust her while I was in school. An actual adjustment, right? Not just practicing. Good. All right. So you're going to put your whole ear in my hand. So I'm trying to restore right lateral flexion and left rotation. So I'm going to put her in that motion, and then when she stops moving, I'm feeling for where her end range is restricted, and then I put my force through that joint into that restriction, and quite a bit better now. Awesome.
That's good.
All right, same thing. We're going to come this way, and we're just going to do a little bit more lateral flexion, a little less rotation. Good, perfect.
That feels so good.
Good. Okay, let's retest. Let's see how you're moving now. Let's go stand by this wall for me. All right, so let's start with this cervical spine. Look all the way over one shoulder. How's that feel?
A lot more movement.
Good.
A lot more space.
Good, other side. Awesome. This was the hard one. Chin all the way down.
Yep.
Good.
A lot more space.
Awesome.
Further down.
Yay. Let's rotate all the way over one side. How's that feel?
It feels really good.
Good. Other side. Perfect. Let's touch your toes. Feet together. Yeah. Look at that.
Yeah.
You're ready for yoga class. You're ready to go teach. Awesome.
Thanks, Steph.
All right. Thank you guys. Thanks for watching. Bye.